So consults. Consults is probably one of the annoying part of what I was doing when I started as an intern. I hate calling consults. It's a very hectic sometimes. Sometimes you call people and they're very mean to you and they are kind of like picking on you and you start, oh, I hate calling this like those fellows and it's kind of like very difficult and I don't know how to manage through this. So this is kind of it's actually this one is a summary that was presented in a paper about like how it's called like the courtesy consult. So how how you're gonna call a consult in a proper way without having any issues. So the first thing when you call, you need to basically uh, present yourself and tell them like, hey, this is Omar. I'm the first year on the first year internal medicine. I'm on team A at the VA. I'm calling you regarding this patient for this purpose. So you need to give like a quick question immediately. So when you're calling cardiology, so hi, this is Faisal. I'm an intern on the med team B. I'm calling you for Mr. Whatever the name. This is his last four, and the reason for the consult is chest pain with concern with ACS or elevated tropes or CHF, whatever. And then you're gonna tell him the story of the patient once he is ready, and then you can tell him like this is you're gonna tell the sense of urgency. Is this like a right away thing or this is a soft console that can wait a little bit? So that's something to keep in mind because they will need also to know how fast they need to see the patient. If you have someone who is pooping bright red blood for the past 15 minutes without a stop and the patient is shocky now, then probably you need to tell the GI for like, hey, this is urgent and you need to see the patient right away. So just keep that in mind. Then you just ask when the follow-up will be and you go from there. So that's how you get rid of this issue. And then sometimes we have like a soft consults or kind of like a questionable ones that like should we do it and then like the consult when you're going to call this consult the consulting service will be pissed off because the consult is very soft and they are busy. So sometimes you just call them, tell them like, hey, I'm sorry, I'm giving you this soft. It's a soft consult and it's not urgent, but we need to make sure that we have an opinion from your service. So they will appreciate that approach and they will tell you it's okay, we'll take care of it, but just tell me what's going on with the patient. Sometimes like you have like cardiac clearance for EGD or you have like some uh, TEE and cardiology were like busy and they don't want to do. The patient was like having one out of four gram positive, and there was like a request for TEE. So sometimes there are like this questionable gray area consults, and then you just need to tell them like, hey, this is a soft consult, not urgent. We appreciate your help, but we need your opinion about this case, and you go from there. Any questions about calling the consults? Anybody having issues calling consults? Any experiences calling consults? Just share anything you guys have in mind. Is that clear? Okay.